Okay, so you can see I pretty well have my pig opened up here, and I can see most of what I need to see, but not everything. I'm going to go up into my neck region because I need to identify the thymus and the thyroid gland. So I'm going to use my probe, which is this pointy thing here, and I'm going to go up into the neck. And the probe is really great for picking away at tissue. I have this really super thin tissue here that I want to pick away at because I want to get up in there and see if I can find everything that I'm looking for. And get just this thin stuff just kind of picked away. So I've got some good stuff going on here. I can see lots of thymus. This is thymus right here. I've got lots of thymus looking really good. And then I also have some thymus that sits on top of the heart. I'm looking for thyroid in here as well, and my thyroid is usually a nice kidney bean structure. Aha. My thyroid is hiding way down here. This is kind of low for a thyroid. Thyroid's usually up a little bit higher. But here's the thyroid right here in my pig, and it looks, like I said, like a little kidney bean. So there's the thyroid. Now I need to find the diaphragm. Diaphragm's pretty easy. It's what divides the thoracic cavity, or the thorax, from the abdominal cavity, or the abdomen. So in my pig, here is the diaphragm. It's this flap that you had to cut through in order to get your pig apart. There's the diaphragm. The diaphragm sits right underneath the heart, so this big thing right here is the heart, and then you have the lungs on either side, and if you look, you can see the lungs actually probably go up a lot higher than you thought, and notice that there are multiple lobes to the lungs. So here's a lobe, here's another lobe, here's another lobe back here, and then you've got more lobes of the lungs over here. I also have the stomach right here, or not the stomach, I'm sorry, the liver right here. The liver is this nice big mamma jamma right here. You open up your pig, first thing you see is the liver. Liver is the easiest one. You better get it right on the practical. Just caudal and dorsal to the liver, we have the stomach, which is this nice big bag right here. That's where all the food is going to go. And then if you look over to the side, this thing that looks kind of like a tongue coming up around the side of the stomach, that's the spleen. So here's the spleen right here. The small intestine is named the small intestine because of its diameter, not because of its length. It's actually significantly longer than the large intestine. This is all small intestine right here, and even this is still small intestine. So this is all small intestine, and then you have the large intestine. Again, the large intestine is named that because of its diameter. It has a much wider diameter, so this is the large intestine right here. Now in the human, the large intestine is a slightly different place. In a human, the large intestine goes up and across and down the side. The urinary bladder is inside my pig. I'm going to snip away or cut away a little bit here so that this is a little bit easier to get to and look at. And I'm going to try to do this without cutting the urinary bladder. The urinary bladder is found between these blood vessels right here, and the urinary bladder is right here. It's this pouch, and that is going to lead to the urogenital opening, ultimately to allow the pig to excrete the waste.